first of all, we need to be clear what we mean by abortion, because certainly in social media, the terms is bandied around, and but they try to equate miscarriage, ectopic pregnancy management, and so on with abortion. It's exactly the same principle, and it's not. Like, there is a world of difference between what we term as induced abortion. I often refer to, in my own country, like when abortion became legalized and after the referendum in 2018 in Ireland, the Irish are pretty cautious with their words, believe it or not. That's why we've got people like 𝘮𝘰𝘭𝘪𝘵 and Oscar Wilde, and lots of poets and writers. So the Irish people love words, and they like words to have precise meanings. So when it came to inserting it into the Constitution, first of all, the word abortion is never used. It's referred to as the Termination of Pregnancy Act. But to be absolutely clear that everybody knows what we're talking about here, it's clearly defined as this is referring to, I do have some objection to it, mind you, because they call it a medical procedure, but they call it a medical procedure, and they use that deliberately to show that it can only be carried out by medical personnel, at least for the time being. That may well be extended, but it's a medical procedure with the intention, and that's I think the key word in the phrase, the intention of ending the life of a fetus, in referring to a woman in pregnancy. So the intention of ending the life, now they go on to determine what fetus also includes embryo, depending on the stage of the pregnancy, because they allow it, without any, for any reason up to 12 weeks. And the vast majority are done by chemical abortions. So I think that's a very important phrase, that it's a procedure with the intention of ending the life of a fetus or a human being. So first of all, that implies that the human being is living and that it's not dead. So it's not a miscarriage situation. It's also within the female reproductive tract in case of a pregnancy. So, but I think the key word is intention. So if we come to, there are some situations where tragically a child will or may have to be delivered ahead of schedule prematurely when there is little or no chance that the baby might survive. In all situations, at least from the ethical pro-life doctor's point of view, every effort should always be made to try, if at all possible, to save both the mother and the child. There are very rare situations where that may not be possible. And I say rare, I'm talking about a handful, maybe a year in this country. So the ones that come to mind would be things like severe infection. So premature rupture of membranes. And mind you, that does not always necessitate early delivery. Sometimes conservative management, if there's no signs of infection, it's not uncommon for a woman, well beyond viability, to have an early premature rupture of membranes, and she doesn't necessarily have to deliver the child immediately. They can afford to wait, see is there any signs of infection impending or developing, and if there is, then the child will have to be delivered sooner. And if it's well beyond the stage of viability, then both mother and child should do very well. If, however, it happens, for example, in the case of 𝘮𝘰𝘭𝘮𝘳 which ultimately led to the referendum in Ireland, if this happens at a stage where well before viability, so 15, 16, 17, 18 weeks, you would certainly try initially with management that might give you some time to allow the child to develop to a stage where viability can be reached, but it may not. If there are signs that the mother's life is in serious danger, grave danger, then the child may have to be delivered ahead of schedule in an emergency setting. So that is, I think, a world of difference away from what we understand by induced abortion situations. That is an attempt, wherever possible, to save the life of the mother and the child, but unfortunately, tragically, it is not always possible to do so. If it was 21, 22 weeks, you would deliver the child in the hope, if the child is not already dead or dying, that you might be able to, with the modern neonatal resuscitation methods, save the life of the child. The only other one that comes to mind would be extensive cancer involving the actual reproductive tract, particularly the uterus, which is very, very rare in pregnancy. The occasional time it does happen is usually after the child has been delivered, but it could, theoretically, it could happen that a woman may have to undergo a hysterectomy before it can be safely waited for the child to become viable. They're the only two real ones that come to mind. Preeclampsia, most cases of preeclampsia can be managed initially medically. Most of them occur well after the stage of viability has been reached. But again, in theory, a woman could develop serious preeclampsia with signs of deterioration before viability has been reached. And in those situations, the child may have to be delivered before viability has been achieved. But in all of those cases, the intention is always to treat both mother and child to save both lives. Obviously, if you let the mother die and the child is not viable, the child is going to die anyway. So that it would be rather silly to say that you can't intervene in this situation because the child might die, but if the mother's going to die. So you have to always try to preserve the mother's life, save the mother's life, in the hope that it will also preserve the life of her baby.
I think in 2021, the number of cases for, I think it's F and G, which are the emergency situation ones, was 2 cases out of 200,000 that they brackets together. So it is rare, but it does happen.
Dermot, do you prefer the term separation of mother and fetus then? I mean, how would you describe it? Because I noticed in all the NHS websites, they talk about the 2 patients, they talk about doing your best to preserve the life of 2 patients, and they don't talk about abortion or even termination, but there's no language there that they're using. So what would you prefer?
Yeah, I think separation of mother and baby is reasonable. As the phrase I used was deliver the child early. As I would try to avoid using the word abortion because it just muddies the waters. It leads to endless debates and that end up going round and round in circles. So I would just say either separating the mother from the child because of sheer necessity, or delivering the child ahead of schedule, knowing that it is very unlikely that the child will survive, but efforts are made as far as possible to save both lives.
And do you know if we're any further along the line of bio baby bags for premature babies?
Right, to deliver a child into an artificial womb type of situation. Yeah. I'm not sure if we're further along. I did read recently of a child that was born at a at the stage of viability who survived and was kept in a special surrounding, special type of I'm not sure, was it a bag or some sort of specialized incubator that tried to, as far as possible, to mimic the maternal environment, the uterine environment. So we probably are. Again, I'm no expert in that area, but a lot of research has been done, and there is efforts to create artificial wombs. That may be something that will come in the AI discussion later on. But the babies are surviving at a much earlier stage than they were. So it was unheard of 10 years ago or 15 years ago for a baby at 21, 22 weeks to survive. 24 weeks was considered a small number might survive. Now 24 weeks, well over 50% should survive. So progress has certainly been made and has been made in recent years.